Hi, I'm Magnus Hansson, Chief Medical Officer at Abliva. For our FALCON study, with the help from patients, we created a specific fatigue questionnaire for mitochondrial disease. And we now use that as one of our two primary endpoints in the FALCON study. Fatigue, an overwhelming lack of physical and mental energy, is one of the most debilitating symptoms of mitochondrial disease. There are different fatigue questionnaires available, but up until now, none that has been approved to be used as a primary endpoint in a pivotal study to evaluate a new treatment for mitochondrial disease. But how do we translate the patient experience of fatigue into something we can reliably measure? We needed to figure out how to quantify both the severity of fatigue as well as its impact on daily life. So we performed in-depth interviews with patients with mitochondrial disease. Their descriptions of fatigue and how it impacts their activities of daily living was mapped to questions from an already established and validated bank of fatigue items. 20 questions were initially identified to match that patient experience. And interviews were conducted again to ensure that the questions were relevant, that they were easy to understand, and that they were easy to answer. The questions that performed best were then selected for the final questionnaire. The PROMIS Fatigue Mitochondrial Disease Questionnaire consists of 9 questions that provide a comprehensive measure of fatigue in mitochondrial disease. And this is the questionnaire used in the FALCON study as a primary endpoint to evaluate the efficacy of KL1333. The questionnaire is also available for use in other mitochondrial disease research, and we look forward to seeing the impact of this tool to help us better understand and treat mitochondrial fatigue.